Hi friends, I'm Red Stegall. I'm an entertainer, author, and proud Texas rancher. I'm inviting my fellow cattle ranchers to join me in the Alamo statewide stampede, a simple way to help preserve our Texas heritage. When you sell your livestock, just let the auction house know you'd like some or all of the proceeds to go to the Remember the Alamo Foundation. If you don't have livestock, no problem. You can still take part by making a donation. These tax-deductible donations will go directly to the Alamo Plan, which is preserving the Alamo for generations to come. And together we'll ensure we always remember the Alamo.
Stories Bigger Than Texas, the Alamo Podcast. A famous painting by William Henry Huddle depicts what happened after the Texas victory at San Jacinto. Santa Anna has surrendered, and Sam Houston is negotiating the terms while lying on the ground with a bandaged leg, his tibia bone shattered by a musket ball. Today we reveal how battle wounds were treated during the Texas Revolution, the types of wounds that resulted from weapons of the time, and why it's important that history remembers how battlefield medicine was practiced. I'm your host, Emily Balcom. Today we're joined by Dr. Bruce Winders, the former curator here at the Alamo. Thanks for coming back on the podcast.
Well, thank you for having me.
The title of this episode is Weapons and Wounds. And I don't want anyone who's squeamish to think, ew, maybe this episode isn't for me, So let's be clear here. Our goal is not to gross people out. So explain how, as a historian, this topic is important for you to know about and to share.
When people think about history, often it's, this happened and this happened, this is when it happened. It's like a list of events. Memorize this and you know history. But history is about people. And what's more human than getting injured? There are some things that in life that people, doesn't matter when you're alive, connects us. Food is one, music is one, and medicine is one. The history of medicine is a glimpse into past life.
On last month's episode called Medicine at the Alamo, we talked about how the Texas Revolution took place before germ theory was discovered. This was the age of heroic medicine.
Heroic medicine actually is derived from the Greeks. And the idea is you've got fluids in your body. You have 4 different fluids. And when they get out of balance, that's when you get ill. And so the idea then was, how do you get the balance restored? From bleeding, you've got bad blood. We've got to get that out of you. Vomiting, inducing diarrhea, things that we wouldn't think were good. But it was, your system has to be purged. The other part of it is sickness is discomfort. Injury is pain. This is going to hurt, so don't expect it not to.
We're going to be talking about how specific wounds were treated, but under general terms, how would heroic medicine approach a wound?
One good example would be the expression about biting the bullet. Again, the idea this is going to hurt, and we can't really give you anything to make it hurt less. Here, bite on this. While we do whatever we have to do. When it comes to operations or things that are putting them back in order, putting bones back in order, the idea was speed. The faster you do it, the less time the patient will be enduring excruciating pain.
There are a lot of ways you could get wounded in battle in the early 1800s. Let's start with firearms.
Well, the firearms, that's what most people think of as somebody's been shot. And our idea of being shot, we get from television. Someone gets shot and they fall down. Well, you may fall down, but there's more to it than that. Musket has a velocity of about 1,000 to 1,200 foot per second, and you've got a 1-ounce ball. And so when that hits, our idea is, well, it just punches a hole. Well, what we found in modern times is that the force from the musket ball or from the bullet is being transferred to your body. What happens is it produces a wave because your body is fluid. You may think it's solid, but it's fluid. And so it produces a wave that sends a shock wave through your body. And as it enters the body, the projectile enters the body, there's a moving away of tissues. So you don't see that unless you do high-speed photography.
Right, I'm starting to think of History Channel reenactments of, what happened, for example, when JFK's bullet hit him. That's the kind of thing you're talking about.
Yes, it's very violent. It didn't just, he got shot. But we just don't see that happening unless you're, like I said, going on and doing high-speed ballistic testing. So muskets are, of course, the things that we think about at this time during war. Rifles, ball is smaller. Pistols, ball is smaller. These are the things that are going to be hurtful or deadly.
And there's a difference if you were hit in the leg, the head, or the upper thorax, for example.
Where you're hit, the angle that you're hit, a lot of different variables, but wounds to the head were thought to be very bad, that you probably wouldn't recover. Wounds to the chest were thought to be dangerous. And the idea was if you're shot in the lung, you have a chance of recovering. If you're shot in both lungs, no, that's because they can see the entry point. They can't necessarily see where the bullet or the wound track is. And so how do they do that? They do that by probing. And the idea is the best probe that you can use is your finger.
Wow. So this was before really modern tools?
Yeah. Today, went into a hospital for a gunshot wound, they'd probably do some sort of scan to find out where the bullet is. But it's guesswork for them. It's an educated guess, but still they don't have that knowledge of exactly where it is.
Then there are what you might call hand-to-hand weapons, swords, knives, bayonets.
The hand-to-hand weapons are really cutting weapons, where we talk about projectiles from firearms. Those are puncture wounds. When you're talking about the cutting weapons, it's lacerations and punctures. The bayonet, from my Mexican War studies, I was looking into the medical aspect and saw very few mentions of bayonet wounds, which made me think, well, the bayonet wasn't used very often, or if you're bayoneted, you didn't make it to the doctor. Cutting and slashing, Bowie knives, tomahawks, those are close combat weapons.
Finally, you have artillery, what most people would call cannons.
You don't want to be shot by a cannon. You don't want to be shot. But a cannonball, very destructive. You take that musket ball and you magnify it many, many, many times. There are different types of cannonballs. There's solid shot that will remove a limb.
So by solid shot, you mean they are just a solid mass?
Yes, a solid iron ball. And so they will literally tear a body apart if you're hit with one. What we sometimes read about in medical literature at that time is grape shot. And grape shot is an arrangement of smaller balls, usually bigger than a musket ball, kind of like an avocado pit, to give you some idea. But there may be 12 of those. And so it turns the cannon into a giant shotgun. When you're hit with those, very destructive.
You gave an example to me that my jaw just dropped, that surgeon reports show grape shots stuck in bodies, 6-pound cannonballs getting caught in the thigh.
I've seen that in Mexican War studies, and I've seen that in a surgeon, British surgeon from the Crimean War, where he's talking about patients coming in, they see an exit wound, or what they think is an exit wound, and so they assume that it's passed through. Whatever the projectile is, it's passed through. And usually then they find out the patient's doing better. Oh, the patient's doing worse. The patient's doing much worse. He's dead. And at that time, they'll do an autopsy, and they'll find out there was a 6-pound cannonball. There was a 12-pound cannonball caught in the muscles, usually of the thigh.
How did they not know?
Well, there was probably swelling, and they just assumed it was swelling. In one of the accounts, it talked about the patient complained about a weight. His leg felt heavy.
They should have listened to the patient.
They found that. Now, grape shot, I found very interesting that in the Mexican War, there's an account from an American surgeon. Patient comes in, and he's been shot in the hip. They stabilize him. He does well. They get him up. He walks around for a few days, and then he relapses. He begins to take a turn for the worse, and then he dies. And when they performed his autopsy, they found that a grape shot had shot off the head of his femur and lodged in the socket that goes into the pelvis. They didn't see it because they couldn't detect it. Crimean War, I've got similar stories of a man being shot in the shoulder, and they operate it and remove his arm at the shoulder, and then several days later, a grape shot falls out.
Wow.
So one of the worst examples of being hit by a cannonball but not killed, there was a officer, American officer, in the Mexican War at the Battle of Palo Alto in 1846. Actually, Ulysses S. Grant is in that battle as well, and he sees this and writes about it. But Captain Page had his lower jaw shot off by a cannonball, and it doesn't kill him. Newspapers at the time chronicle his injury, And then he's tripped to New Orleans and then up Mississippi River talking about how horrible the wound is. And he eventually dies because he can't eat. Terrible, terrible destruction, ripping off limbs, facial deformity from musket balls and cannonballs. And one of the things that you don't think about is secondary projectiles. That Crimean War document again, surgeons are operating on a man and says, here, we found these coins in your hip. And they assumed they were in his pocket. And the projectile drove them into his hip. And he said, I didn't have any coins.
They were just putting anything down the barrel of that cannon at that point.
Or the person in front of him had coins in their pocket and was hit, and then the coins were carried back to that person. So secondary, just because a cannonball hits somebody doesn't mean it's going to stop. It may hit somebody behind it.
Well, a good place to get perspective on the size and weight of these cannonballs is the second floor of the Alamo exhibit at the Ralston Family Collection Center, that cannonball wall where you can actually go up and see the different sizes and touch them.
Yes.
Let's put ourselves on the battlefield. You get injured, maybe you can walk, maybe you can't. What happens next?
It's odd. Some people who leave accounts will say, I didn't know I was shot. I felt a shock, but I didn't know what it was. And I carried on, and then later I saw I was bleeding, or I became faint. There's that idea of shock. If you are shot and you're knocked down, you know it. The idea is who's going to help you. First responders are going to be those people that are around you. If they're not too busy, they will take care of you, your comrades in arms. Then you're probably going to lay on the battlefield for a while until somebody comes and retrieves you. The idea was you don't get treated during the battle, but you get treated after the battle.
And who treats you?
That's when your friends take you to the doctor, or there's organized parties to bring the patients to a collection point. Doctors at that time, especially in the Texas Revolution, usually come from civilian life. And so they may have seen that type of wound before, they may not have. If you are in the Mexican army, who's going to take care of you? It's probably going to be camp followers, who are your wives or your girlfriends or family members, because there was a lack of medical personnel in the Mexican army.
You talked about civilian life. The way that people practiced medicine was very different depending on if they practiced civil medicine or military medicine. What's the difference?
The difference between civil and military medicine is they're going to be treating the same types of things. It's going to be the quantity. A civilian doctor may treat a gunshot, but he's not going to be familiar with multiple gunshot victims. Living in the 19th century was dangerous, and so they're going to see some of the same types of wounds. Civilian injuries, being kicked by animals, a lot of that. Crushed by wagons or run over by wagon wheels. One of the horrible things that I've read in newspapers, children climbing trees and falling and getting impaled on broken branches. That's the type of thing that a civilian doctor would deal with. Military doctors, they're both doing illnesses and things like that, but it's military doctors that are going to see larger numbers of catastrophic wounds. One of the main differences between civilian doctors and military doctors is that civilian doctors have time. They're not dealing with the crisis of multiple patients, so they can take their time dealing with one patient. Military doctors have to deal with multiple patients, so their time that they can spend on a particular patient is limited.
If most of the doctors in the Texan Army were civilian doctors, where did they get their training?
Being trained as a doctor in the 1820s or 1830s, several different pathways. One of them is you studied medicine or you had experience watching somebody do it, and you called yourself a doctor. Well, I can do that. I'm a doctor. And you go to an area where they don't necessarily know that you're not a doctor, but if you are producing good results, then you are a doctor. The other thing is apprenticeship, that you would serve in a doctor's office. He would let you read his medical books. You would do menial tasks for him, but he would pass his knowledge on to you. And then finally, when you had enough, you would go out on your own and you would be a doctor. But there were medical schools. If you were of an upper class, you had the means, you would go to actual medical school where you would attend lectures and study.
That seems more like an East Coast thing at this point, not a frontier Texas. Am I wrong?
The medical schools were in the East. There's one in Vermont, Philadelphia. So yes, academic medicine was an East Coast.
So once these doctors have evaluated a wound, what factors impact their treatment and the healing process?
Well, the factors for wounds are what caused the wound, if we're talking about musket balls and rifles, what is that? Cannonballs, is it a cut? Is it so that, what type of wound it is? And wounds were categorized by the location and the severity. Slightly wounded usually was a flesh wound. Severely wounded was beyond the skin and affecting organs or bones. You would categorize it. The angle of shot, the distance from the shot, because it would lose power the further the distance. So you could be struck by a spent ball and knocked down but not hurt. And then where did it go? Is it still in there? Is there an entrance wound? Is there an exit wound?
And like today, sometimes it's better for the patient just to leave a bullet in there.
Well, the idea about leaving the bullet in, the medical doctor that I have been reading about says in civilian life, the idea is to leave the bullet in. Military life, we want that bullet out if we can. But the problem was, do you have to do more damage to get the bullet by opening the wound further to be able to reach the bullet than actually having it heal up?
And they're doing all this without any sense of cleanliness, hygiene, like we know it today.
Well, they probably thought they were, but the military doctors would warn against leaving the bullet in because they'd say it can impinge on something, it can travel, so it's best to get it out if we can. Andrew Jackson had bullets in him from duels. Other notable people carried bullets. I think Sam Houston had some projectiles in him.
Today, doctors take an oath to act in the best interest of the patient and to do no harm. So what happens when you're at war? The idea of who treats the other side, that really did come into play in the Texas Revolution.
We don't have a lot of accounts about Texan doctors treating Mexican patients, or the Mexican army didn't have the doctors to treat the Texan patients. And the idea was, if you're a land pirate, we're going to kill you anyway, so why should we? But the accounts that we do have is after Goliad, the doctors that are in Bannon's command are told that they have to treat the Mexican patients before they can treat the American patients.
And the Mexican army might have learned a little bit that the doctors at the Alamo were killed. So who's going to treat the wounded there?
In San Antonio, after the Battle of the Alamo, the American doctors have been killed. Santa Anna probably had a personal doctor, but the medical department in the Mexican army hadn't been organized yet. And so Santa Anna first, immediately after the battle, asked townspeople to come and get the wounded and to care for them. And as we talked about, camp followers, if your wife, if your girlfriend, if your family members, somebody's, they will come and take care of you. But one of the things that happens at Goliad is that they identify the doctors and they don't put them into the massacre. And then several weeks later, they send two of the doctors to San Antonio to treat the Mexican officers who've been wounded. And when they arrive, they said, we've seen these Mexican soldiers. Some of them are laying in the same spot on the same blanket that they were a month and a half ago without really any treatment. And so they've been sent to treat the Mexican officers, but they treat the Mexican common man, soldiers too. There appears to be really no animosity about, I'm not treating you because you're the enemy. Doctors are pretty good about, you're a human. I'm treating you because you're a human.
Circling back to the introduction of this episode, we referenced the famous painting showing Sam Houston, badly wounded, negotiating the terms of Santa Anna's surrender. He puts off medical care until this deal is done. His leg is probably infected, but as we've talked about, germ theory had not been discovered yet. So what does this painting represent to you about the weapons and wounds of the Texas Revolution?
The Huddle painting from San Jacinto and the fact that Houston's lying there points out the fact that, hospitals as we think of them, you get injured, you get rushed to the hospital, you get taken to a collection point, and it may be under a tree. It may be in a barn. It may be, somebody's house. So all the apparatuses that we think of with hospital, it's very, very sparse. People used to be born on their kitchen tables or have their tonsils out on their kitchen tables. Anything became an operating theater if it met the basic needs of there's space to do here. This is where we're going to do this. Houston's wound is really interesting because there are several cases in battle where Jefferson Davis in Battle of Buena Vista in 1847 is wounded in the ankle. He's on horseback. Sam Houston is on horseback when he's wounded. Somebody isn't actually necessarily aiming at them, but they're aiming at the level of somebody's chest, really, because that's where your ankle would be. Albert Sidney Johnston, killed at Shiloh in 1862, is shot behind the knee and it cuts an artery, and nobody knows until he falls off his horse. It goes back to the question that we ask, why should we care about this topic? And again, it's so human. Everybody can kind of imagine what would happen if that were me. What would I do if a friend, a family member, because these were community volunteers, what would I do if that person were shot?
Moving forward from the Texas Revolution, technology is evolving during this time. Let's talk about the rifled musket and the Manet ball. What are those, and how did they change the game?
Well, one of the military challenges had always been, we know that the musket, you can load it faster, rifle's more accurate. How do you put those two characteristics together? And the answer was the Manet ball or the mini ball, what most Americans say, was a projectile that was conical shaped. It had a hollow base. It was smaller than the bore of the barrel, which allowed it to fit down the barrel easily, well, not actually easily, but easier than a musket ball. And when you fired the musket, the powder would expand the base of the ball. It would then grab the rifling, cause it to spin. Now, in the Crimean War, that's the first war in mid-1850s involving the British and the French and the Russians, that you begin to have rifled muskets used, the mini ball. And my British surgeon, whose name is MacLeod, one of the things he writes about is we're seeing a transition. He says, a musket ball, if it hits you in the arm, it may travel. If it hits you in the shoulder, it may come out down to your elbow because it's lower velocity and the muscles and things will cause it to travel. He said the new style Manet ball, conical ball, acts like a wedge. And so if it hits a bone, a long bone, what it does is it shatters it. And so that leads to the amputation or the need to amputate because you can't put a shattered bone back together. And the idea, if you're hit in the chest or in the abdomen, it does such damage that it's much more severe than a common musket ball. It changes the war, and it's sort of setting the stage for what we think is happening in the Civil War.
You are going to be speaking on this topic next month at San Jacinto. And if anyone wants to go to your talk and learn more, what do they need to know?
I'll be speaking about this topic at San Jacinto on Saturday, August 16th at 5 p.m. If you're in the area and you'd like to come, I'd be happy to see you.
Maybe schedule a road trip. Dr. Bruce Winders, thank you so much for joining us.
Thank you very much.
Be sure to check out the podcast notes. We've linked to more on Dr. Winders' upcoming talk at San Jacinto and how you can get your ticket. And we've linked to that William Henry Huddle painting we've discussed entitled The Surrender of Santa Ana, so you can take a closer look. You've been listening to Stories Bigger Than Texas, the Alamo Podcast.